very common question from patients is why some surgeons don't put implants in through the armpit or the belly button. Richard, what's the deal?
Well, I think there are certainly people who've had a lot of success doing that, and it's natural for the patients to want to avoid a scar on the breast. But most plastic surgeons don't, and I think there are reasons for that. For me, I like to see more directly into the space that I'm creating. If there's any bleeding, I want to be able to deal with it right there. And it's more of an indirect approach if you're doing it the other way.
Well, I think it's important to remember why these incisions were first created, or why they were first tried. I mean, the tube or transumbilical breast augmentation and the transaxillary or incision through the armpit, both those operations really originated when we were using saline implants. So those implants came empty. You could roll them up like a cigarette, put them in through a very small, short, remote incision and tunnel them up to the breast. And really, you know, at least in my practice, 98% of the implants I put in are silicone. So these incisions are just not practical. I mean, certainly the belly button incision is a non-option when it comes to a silicone implant.
Yeah, exactly. I think it's also important to keep in mind there's a reasonable probability over that patient's lifetime that they're going to have a reoperation. Maybe they're just going to downsize their implants or whatever it is, but it's not really as feasible through either the axillary or the umbilical incision. So if you have an incision that you've already made a scar, it's easy to go back in there, and those scars do really well. Patients are really not unhappy with the way those scars look.
I mean, I completely agree. I just this past week I saw a patient that had a transaxillary breast augmentation, and then she required a revision on that one side, and within 6 months of the initial operation, that surgeon made an inframammary fold crease incision. So now the patient has 2 incisions. Granted, the axillary one you don't really see that well, but again, I don't think it's worth the benefit of putting a long axillary incision in to get a silicone implant through a remote place and risk implant malposition or a bad aesthetic outcome for really a scar that's short on the breast, and it doesn't really bother patients.
Yeah, the one thing that I see sometimes is people, I feel like it's a little bit misleading when they say like transaxillary breast augmentation is a scarless breast augmentation. It's not really a scarless, right?
It's not really a scarless. I mean, the scars do fairly well in that location, but that's also an area that's going to be exposed when they're wearing something sleeveless or a swimsuit. That's a scar that is going to be exposed.
Well, thanks for clearing that up, and if you want to see more of this, you can see it on the plasticsurgerychannel.com.